I'm excited to be able to present our late-breaking abstract on behalf of BMT-CTN 1703 study team. This is a graft-versus-host disease prophylaxis study, a randomized phase 3 study that randomized participants to the control arm, which was Tacrolimus methotrexate, which has essentially been the standard in our field for several decades, versus the experimental arm, post-transplant cyclophosphamide, Tacrolimus, and MMF. Participants were randomized 1-to-1 to either of these GvHD prophylaxis regimens. The primary endpoint of the study was a bit novel for our field. It was graft-versus-host disease-free, relapse-free survival. So we wanted to see, could we improve the outcomes of graft-versus-host disease without worsening other outcomes such as relapse, progression, or death? And I think you've seen from the abstract that indeed the experimental arm did have a better graft-versus-host disease-free, relapse-free survival. And we're so excited about this. We think that this will revolutionize our field. It's amazing to be able to see some significant improvements in acute and chronic graft-versus-host disease without the expense of increased risk of relapse or death. So we do think this will be a game changer for our field.